So thank you for inviting me to speak today. I'm going to be covering the allergy portion of the Loeys-Dietz guidelines. And when Loeys-Dietz was described 10 years ago and we began taking more family histories and patients we were seeing in clinic, we began to appreciate reports of having a lot of allergic disease in this population. So we were very lucky and honored to have two young investigators join our Loeys-Dietz team at Hopkins. Pam Frischmeyer-Guerrero is an allergist and immunologist who's actually now at the National Institute of Health. And Anthony Guerrero is a pediatric gastroenterologist at Hopkins. And they began to see patients on a clinical basis and undertook a large questionnaire, sending it out to patients and drawing a lot of blood to try to figure out allergic disease. And so all of the data that's presented today and much of the counseling was written by them for the guidelines. So the first allergic disease they looked at was the prevalence of seasonal allergies, and we usually think of this as congestion, runny nose, itchy eyes, especially at the change of seasons when there's a lot of pollen in the air. But the symptoms can really be year-round if they're triggered by indoor allergens. So in the patients that answered the survey, the rate of seasonal allergies and Loeys-Dietz syndrome was 48%, and this is compared to the general population rate of about 8 to 10%. Of those with seasonal allergies, about 61% had 2 or more allergies to airborne allergens. Now, when we look at asthma, which is a lung disease that causes inflammation and narrowing of the airways, causing wheezing, in Loeys-Dietz syndrome patients, it's reported in about 45% compared to the general population of 10%. And of those patients with asthma, about 28% had prescriptions for asthma medications. Now, when we looked further into asthma disease, we saw that it was frequently driven by chronic sinus infections, and it seemed to be driven by the craniofacial features of Loeys-Dietz syndrome rather than a specific defect causing recurrent infections. So their nasal cavities were not draining mucus effectively. And we find that if you aggressively treat the sinus disease, you're able to decrease the symptoms of asthma. And sometimes aggressive treatment includes weeks and or even seasons of alternating antibiotic use. When it comes to medication treatment of asthma, we typically try to reserve the use of bronchodilators for severe episodes. This medication relaxes airway muscles, but it also increases blood pressure. So for chronic daily management, we try to prescribe inhaled corticosteroids, such as Flovent, for daily use. It's also worth discussing with both your allergist and your cardiologist your medications, especially some of your blood pressure medications. So beta blockers is a medication that people are on for blood pressure management, and there are different types. Some work on receptors that are mostly in the heart muscles, some work on receptors that can be both in the airways and the heart tissue. And so we don't think that they cause asthma, but they might exacerbate a predisposition. So it's worth talking about your medications and your symptoms with both doctors. Also, we recommend antihistamine use and or intranasal steroids for chronic rhinitis rather than decongestants. Decongestants contain some chemicals such as ephedrine or pseudoephedrine that can increase blood pressure or cause some other cardiac symptoms. When we look at eczema, which is basically scaly, flaky skin, it's usually found in response to a food allergen trigger, but other things like change in temperature, humidity, viral infections can cause flare-ups. In Loeys-Dietz syndrome, we've seen this in about 38% of patients compared to the general population rate of 8%. And treatment is really aggressive moisturizing, and sometimes individuals need to have a prescribed ointment or topical cream. Also, avoiding your food allergen. So this is an example of a girl who has very severe food allergies, and some of the diets can be very strict. And so she wasn't really into the diet in the very young ages, and you can see the severe eczema that she has. But when she got on track with avoiding her food allergens, the eczema went away. Sometimes when the eczema can be quite severe, it can cause some blistering, or if the kids are really itching it, you can get infections, which also need to be treated then. So when we talk about food allergy, it's important to differentiate between a food intolerance and a food allergy. So in a food allergy, it's typically an immune response to a food protein compared to a food intolerance, which is usually a response to a carbohydrate. And a food intolerance is typically going to cause a GI disturbance and perhaps not systemic problems. In a food allergy, even exposure to a very small amount of the allergen can cause a reaction, and reactions can be very severe and even life-threatening. So using a very stringent definition of food allergy, which is either a positive skin or blood test and or evidence of an immediate reaction, we found a prevalence of 31% of food allergies in Loeys-Dietz syndrome as compared to 6% in the general population. Most individuals with Loeys-Dietz syndrome have 1 to 2 food allergies, but some individuals can have multiple. The food allergies in Loeys-Dietz syndrome mimic those in the general population. So in children, it's milk, egg, peanut, soy, wheat, tree nuts, and fish. And then you can see the allergies in the adult and adolescent population. And again, the symptoms can be very variable, from chronic low-grade symptoms such as the eczema to more severe life-threatening reactions. In the skin, you can see the eczema, hives, or angioedema, which is some subcutaneous swelling, cough, congestion, wheezing, breathing difficulty, all the way to hypotension, shock, and anaphylaxis, which is kind of a systemic problem but can cause constriction and narrowing of the airways. Food allergy symptoms can also include gastrointestinal features, which Dr. Marcon is going to touch on next. If there's concerns about food allergies, you typically see an immunologist who is going to perform skin and blood testing, either a prick test or doing a blood test. But it's important that you don't make solely your decisions about what foods to avoid based on the testing. It really is an interaction of the testing and your reaction symptoms and your medical features to make a decision about which foods to avoid. And treatment is basically food avoidance. In some cases, with those individuals who have very severe allergies, they do require feeding tubes in some extreme cases just to make sure they're getting enough calories and nutrition. And in some cases, after a portion of time and under your doctor's advisement, there can be some reintroduction trials of foods. So many patients are prescribed EpiPens for treatment of their food allergies, especially in emergency situations. And EpiPens an injectable pen that releases epinephrine, which relaxes smooth muscles to help breathing, but it does have some cardiac side effects, including increase of blood pressure and elevated heart rate. So we do have some concerns about the use of EpiPens, but again, it's always worthwhile that you need to discuss with your physicians when is the appropriate time to use this, and also to discuss with your school and other care providers when is the appropriate time to use EpiPens. It's important to work with your schools, your peer families, other providers, so that you make sure to have your child in a safe environment, but also hope that they don't feel isolated or stigmatized because of their food allergy. So I put this picture up of 2 of our kids who've actually taught me a lot. The boy has very severe GI disease due to his food allergens. And I remember going out to dinner with his family once, and he was very excited because at that time he was able to eat potatoes, and the next day they were introducing cantaloupe and tomatoes. So it gives you kind of the most severe end of the spectrum of trying to introduce foods and figure out what your food allergies are. And this girl, I got her permission. I just saw her in clinic this week, actually. When I first saw her 6 or 7 years ago, she was really struggling with her food allergies because as a 6 or 7-year-old girl, the most important thing is to go to a slumber party and to be, have that experience with your friends. And because she was having overnight feeds and had so many food allergies, she wasn't able to go to slumber parties, and it was really, really hard for her. And she just stated that, and she's about 10 now, that she went to a slumber party this weekend, and the peer mom had called the family and it's like, let me change all the foods, let me make it safe for her. And they said no, and what they did at home was they made safe pizzas, and they figured out a cupcake recipe that didn't have eggs and soy and things like that in it, so that she could go to the slumber party and eat the same food and have a normalcy, which is really important in these patients. And there are a lot of really great resources out there, both online and books, if your child has a food allergy and you need to figure out cakes and snacks and things to take to school. So Loeys-Dietz is associated with allergic disease. We discussed seasonal allergies, asthma, eczema, and food allergies. Dr. Marcon is going to talk about allergic reaction in the gastrointestinal system, and the most frequently seen allergic disease there is eosinophilic esophagitis. And so now that we kind of know this information, what are we doing to move forward? So we continue to recruit a lot of patients who give a lot of bloods, for which we're very thankful, to look at different pathways and immune testing. And we're also looking at families, individuals either within a family or different families with the same mutation, and comparing the DNA of those who have allergic disease and those who don't have allergic disease to see if we can see if there's any modifiers or information that tells us who is going to be at risk. And again, we have mouse models of Loeys-Dietz syndrome, and the mice do have the allergic GI disease, and they're actually really primed to have peanut allergies. So we do think that they're going to be a very good system to try trials with and try new medications with, both in the immune and the GI systems. So with that, that is allergic disease. If there's questions?